cause of death in this country, back up closer to number 1 as it was in April. That's hardly a disease that's not a problem.
Let me ask you to go deeper on that last point. Some people have asked, why does everyone assume it gets worse in fall and winter? Explain what happens environmentally. You mentioned it by nature forces us inside.
Yes, indoor air doesn't have the same circulation as does outdoor air. The virus dissipates much more quickly outdoor air. While we don't have the data yet, I'll be willing to put dimes to dollars that the transmission that we saw with the Rose Garden ceremony didn't occur in the Rose Garden. It likely occurred in those meetings that were held prior to the ceremony in those smaller rooms in the White House itself, where many of these people who are now infected actually were standing next to each other for some period of time. As I sit here in the studio right now, Brian, with just 10 minutes of my talking, I fill this room full of these aerosols, these small little drops, where if I were outdoors, they would dissipate. So now that we're coming into the fall season, where we're going to spend much more time indoors, we're just going to see the potential for this transmission to go up precipitously.
Yeah, I think you're right on the Rose Garden event. People have tried to create graphics showing the tie between people who've since tested positive, but I think in all likelihood there was not one but two interior receptions on that very same day.
Right.
Hey, Michael, the New York Times is reporting tonight that the White House is trying to block FDA measures. The FDA is trying to make it tougher for a vaccine to come to market, say, before Election Day, that doesn't belong on the market. What's a guy in your line of work to do when the White House is trying to muscle around the FDA, and the FDA is going to be looking for other governance to make sure no bad vaccines come to market?
Yes, well, it's timely. I actually have an hour-long webinar with Commissioner Hahn later this week live that will cover these very issues. And I can tell you right now, we in the public health community are absolutely frightened by this proposition that the administration may decide on its own to bring through, based on an emergency use authorization of a licensed vaccine, and also require a company to make it under the Defense Production Act, even if they don't want to. And why that's really important is because we as a public health community have a very, very solemn oath to the public. We will not bring through vaccines that haven't been demonstrated to be safe and effective. And I believe the FDA is trying to do just that. There's no politics here. It's straight science. And I would hate to see us in a public health in the community have to stand up and say, no, this vaccine is not ready for prime time, just so that it might have a political advantage in someone's court. That would create even more distrust of what is already a challenge, trying to get people to understand why these vaccines are important. So this would be, I think, one of the cruelest blows to public health that I could imagine in my 45-year career if this actually happens.
Michael Osterholm, thank you for always taking our questions. Thank you for staying up with us and educating us and our audience. Coming up for us, Donald Trump bragging tonight about